Kenny is doing nail surgery, not nail surgery, nail cutting.
There you go. Little tiny bits.
Yeah, just take it. Well, take it slow.
Yeah?
Yeah. This one will be more painful.
This one is going to be less cut. I'm not going to go as far down as Marion did with the other one, because actually there's a bit more attachment here. But the problem with this one was more the this raised bit here.
Yeah. Move your finger away in a minute. Yeah, that's fine.
Although that is.
Do you want to wear the mask, the goggle? Are you okay?
Yeah, I might do. It's flicking everywhere.
Just, I just wear glasses. I told you that your treatment, this would need more time than the allocated time. Just complicated. Loads of angles, and especially when you have a sensitive patient, you just need to take your time with it. Yeah, it's not actually that bad. You're not actually that bad.
It's sometimes the anticipation of the pain is even worse than the pain itself.
Yeah, I know what you mean. I had a epidural spinal block, and everybody said it was very scary and stuff like that. So the anticipation of somebody trying to jab a needle in my spine was crazy. I know.
No cutting yet. I'm just there you go. Little bite, little nips. Little nips.
That is detached, I believe.
Yeah, it is detached. I don't wonder why.
So it's just the probably the pressure from the base.
Yeah, exactly. I'm trying to hold. Do you have any smaller ones?
Nope.
Well done. This is actually still detached. I can see all the. Let's see if I can just pull it.
Yeah, just pull it out. Yep, there we go.
It just came out.
Yeah, but it's very involuted.
Can you see?
Yeah, use the black file.
You see it's curved.
Yeah, this is gonna be a bit hard to do this one.
Because it's
It's really.
I'm not cutting. I'm just getting rid of all the gunk underneath.
Yeah, that will help.
So look, I can put this quite far in. This is not attached. I'm not actually cutting anything. No,
nothing is attached.
Down here is attached.
Yeah, the only bit that's attached is really just where Dr. Kenny just, had a...
Right, there's all this gunk underneath that we're trying to get rid of here.
Yeah.
Okay?
That's the ingrown.
This bit.
That's where it curves.
So look, this is what I'm trying to cut out.
That needs to go because I think that's the thing that's causing a lot of pain.
Okay.
Try to cut just in the middle.
I'm gonna cut in and let it.
From the middle.
Okay.
Are they like small cutters? It's like smaller cutters.
The smaller cutters, but the nail's too thick. It will bend the cutters. It's not going to do anything.
I'm struggling to cut out these big ones.
Yeah. So it's not the size. You just have to do it bit by bit, because if it wasn't that painful, we can just go in and just grab it, but because it's so sensitive, that we just need to be really careful with it. So
there we go. Okay,
Dr. Kenny is just really taking chunks off bit by bit.
Good. I'm doing things at angles so that it breaks off.
So the ingrown.
There you go, look.
Yeah.
Another bit of ingrown chunk there.
Yeah, there you go.
Yeah, can you see?
He clapped. Keep it clapping. That was a good.
Marion doesn't get claps.
You better clap when I do the surgery, man. Be careful, he's making a face. Thumb down, lower down.
Okay. Well, that was a big chunk we took out actually before. That was the main bit.
That bit that was cutting into that skin.
That was the bit that was cutting into. Let me just check how far down I can still go.
I know. You've left it a bit long, hasn't it?
It's been a while, yeah, because I
Yeah.
was traveling, and honestly, like, I just get emotionally tired of it.
We'll put something good on TV for you next time. You know what? I think I might start filing it in a minute. I might drill a bit more.
You can drill it thinner.
Yeah, that's what I think I'm gonna do. Just to make it a bit. Here we go. Here we go. Just
There's a lot of debris inside.
Just to make it a lot easier for myself. Just pinching out debris. Look at this. Sorry, I know you're pushing against my thumb to get away, and I'm pushing against your thumb to make it right there. Up. Oh wow, actually, it's a massive hole underneath here.
Yeah, it's all detached.
This is actually.
In theory, you could just cut everything back.
This is a millimeter raised hole here. Not medical. Just.
I've seen this before.
No, it's more that it makes sense why it causes you pain and why so much stuff gets trapped in it and all that sort of stuff.
There's
It
a massive
makes
hole in
sense.
it.
This is just a massive raised cave. I don't know if you can see. Okay, I'm going to cut into this way and get it down to about here, okay? Because that's where the hole leads up to anyway.
Feel a bit of pressure.
So you shouldn't really feel anything whilst I'm doing that, but it's just when I get around to the edges when it gets a bit sensitive.
Excellent, that's a good piece.
This is a good chunk of nail that's going here.
You feel a bit of pressure. Well done, excellent. Still a lot of debris underneath, isn't there?
Same as before, just
Well
the other
done.
direction. Same.
Even I feel pain for you. Yep, it's coming off. Excellent, look at that.
massive
Oh,
chunk
beautiful.
there.
Beautiful, that's good. I think bevel, file, I think that's good. You can remove the debris.
Yeah, let me just pinch all the.
Yeah.
Let me use a file.
Yeah.
There you go. That's about as far as I want to go.
Yeah, that's about it. I think.
Should they saying that? Look.
I know. You could do more, but let's file it down. You can use the drill piece to clean inside. Yeah, it's getting sensitive.
Sorry,
That's where
let me just get rid of this in this gap. This in this gap. I just want to get rid of this little pointy bit here.
Before.
Yeah.
Your body. Hands away.
me to put my foot down? Is that easier access?
Yeah, it depends on the person. Some people like it up, some people
I
like it.
just like
I just want to do the edge here. You can put his foot down. You can put it flat. That makes you good.
See, I'm serious.
Yeah, you gave me a clap. I want a clap.
He was more gentle, but I like the way he was.
Yeah. Sure. Well, we can compare surgeries. He can do one, I can do one, and then you can like I can do one injection, and he can do one injection.
Let's be honest, men are more of like chicken baby. Does not like it so well.
So you rather have a okay, that's fine. It's okay. I'll forgive you. It's okay. So thick, isn't it, that nail? Is that an angle?
You can literally just.
Well, yeah, it's just really taking such like something.
Yeah.
It stops the rotation.
It's almost as if this one is a bit more than that.
Yeah, it is.
It is
At
nice.
the base.
It's funny that this one is always the least damaged.
It's they're both similar, to be honest.
Yeah,
it's just
yeah.
this one's
But
more.
like it's always started with this one. That's where my problem started. And then that one kind of.
Just came along with it.
This is going to be a 7 years of like dancing with them.
Yeah, I
Just
remember.
dancing for a while, then I was on and everything.
All that hormone.
And then the surgery before, I've had like 2 on each.
I know.
I think 3 on each.
I think you just have loads of things going on with the toes. And like I said, we'll see what happens. Because it's quite yellow. I think there is some type of infection inside. But when I grow this, I'm going to save some nails for a different test. But usually for ram horn nails, when you grow it, it's negative for some reason. For PCR culture, like 95% of the case. So I'll keep them for the TNT test, the instant test, so that if it is fungus, then Dr. Penny can give you oral medicine. Always. At least you know you're getting the best, right? Yeah.
This is going to.
I did that in my research. I always like pick on somebody and be like, dude, my kid don't know, but I'm
Who's your latest I'm watching.
yeah, I'm watching you.
Ridges, so that it's easier to take off those ridges. So now I can just need to flat it out.
Before, now it's quite flat. So we really want the edge to be completely flat. Hands away, Kenny. So you can see there's a ridge there. So we really want it to be completely flat. It's really pumped up before. And the good thing about water fields is that I'm touching the nail, and then we'll see what happens in the it's definitely gel surgery in there. I should put Quasimodo in there.
It should be called something because honestly, it's kind of looks like Quasimodo.
We're like, I'll put that on I'll put it on Quasimodo nails, and then you know it's you.
Yeah.
Like, oh, that's me, that's my nail. That's a bit, no, that's fine. It's just a bit, file the top too much. Late the top. Oh, it's okay, we'll sort that out later. Yeah. I'll have a look in a minute.
Okay?
Yeah. And let's just have a look at the dates and stuff. Right, so I think I'm gonna stop first week of December. It's removing quite easy. it's not a big deal. He'll work until quite late. But if I give birth, he might not be here when yeah. Thank you for watching me and Dr. Kenny discussing about this nail treatment. If you haven't subscribed to my channel, please subscribe and remember to push the notification button. Thank you very much. Bye. If you haven't been receiving my notification, that is because there is an error on YouTube. Please unsubscribe and then resubscribe and then push the notification button. That should work. Thank you very much. Bye bye from Dr. Ken. There was a,
It was like this thick. I'm not even exaggerating. It was like this thick, and now it's a bit more flatter. I could thinnen this bit a bit more, but you're starting to get a bit sensitive. And I'm getting, and it's this is all. See, this is still all attached here.
Yeah.
I don't want to take too much off.
No.
It's good. I mean, ideally, I could take all this off.
Yeah.
I'm not going to.